everybody, and Happy New Year. And Judith, wow, what a fantastic welcome and introduction. Thank you very much to you. And yes, friends, so I'm Ketan, as you just heard from Judith, a councillor in Brent and chair of Joint Health Scrutiny Committee in Northwest London, and also the lead governor of Central and Northwest London NHS Foundation Trust, who provide mental health services and who are working jointly with West London NHS Trust to integrate services better. But friends, this topic goes way beyond what the NHS does. Though investment is increasing in camps, the NHS needs to develop better ways of using it, much closer and much earlier in the process, because it has to be priority for everyone. Our communities, our schools, youth organizations, and also our extended families, recognizing the overlap between physical and mental health. So friends, COVID has dramatically increased distress amongst young people and some social disconnection that has occurred, has made the situation much worse, seen perhaps at its worst around the tremendously sad, tragic events of children killed in knife crime. There are also children with autism or learning disabilities that have been under severe and pressure and have served that needs to change. Last July, Young Harrow surveyed over 6,000 young people in 25 schools and colleges. And I suspect these conclusions are true for most, showing that many causes, effects themselves cause problems. This tells us that we need to do our bit to help. However, despite this situation, there is plenty of reason to feel positive. There is great urgency about this topic and a willingness to campaign around it for all. It's an overused saying, friends, that when it comes to children, it takes a village to raise a child. We must all play our part. And to help us navigate, as Judith was saying a few moments ago, the choppy waters, I have a panel of my great friends, and indeed some great experts amongst us this evening. So friends, first of all, I would like to introduce our first guest, Professor Js Bambra Cbe. JS, as we affectionately call him, is a senior consultant psychiatrist in Manchester and has held a number of NHS roles, including more recently as the medical director at Manchester Mental Health and Social Care Trust. He is a director and council member of the British Medical Association and trustee of a number of charities. So JS, really good to welcome you this evening. And if you could just kickstart the evening with an overview of what CAMS is all about. And perhaps if you could just focus for a moment or two on what the key priority for you is. And perhaps 3 minutes would be a good run, please.
Well, thank you very much. Yeah, thank you very much, Ketan, and I'm delighted to be in great company. So, well, 3 minutes should be just about enough to give an introductory message about this. So I'm a psychiatrist. I'm not a child psychiatrist, but obviously as medical director, I've had many roles to play. And certainly as we head towards Children's Mental Health Week, you will know that that is the 7th to the 13th of February. The theme is growing together, and that is the essence of what CAMS must be about. We are seeing, particularly during the pandemic, many challenges for children, And sometimes I think we as adults shield them to what children, and I can see a young child in our audience, which is wonderful to see. Sometimes we assume that we must protect children and therefore not tell them things. Well, assume that every child wants to know and has a reason to know. Not knowing things makes it really doubly difficult for them. Sorry, there's a noise coming from somewhere. If people can mute themselves, that'd be great. So really,
thank you very much, Js. I really do want this meeting to be really interactive, but I think when our guests are speaking, if you could all remain on mute, please, that would be really helpful. Thank you, friends.
So it's important to be upfront with children, because if you don't tell them, they will get knowledge from somewhere else. Now, education-wise, it's been a real challenge for them, because not only that, a lot of the children, their social side is with the children who go to school. And so education, virtual learning has had its advantages, but it's had its disadvantages as well, particularly as children like to be there in a proper playground and not a virtual playground. And so it's been difficult to normalize that. Uncertainty has made things difficult, mixed messages. Sometimes we give them as adults. These mixed messages, important not to do that. So what have we seen? Well, we've seen quite a lot of trauma. We've seen quite a lot of self-harm. We've seen quite a lot of stress. We've seen bullying as well. And all of these things impact on children's mental health. The one statistic that you need to understand is 80% of adults with chronic mental disorder, their mental health problems start when they're children. So when we say give children the right start, it really, really does mean exactly that. Children born in poverty are more likely to end up in poverty. And of course, COVID has put a glaring microscope under health inequality. So we know that people from a BME background particularly have been disadvantaged. And we know that school meals have been a challenge as well. And children who have mental illness, their educational attainment is underachieved because of that mental health issue, but also children who have poverty, who get school meals, they are less likely to achieve their full potential with education. So lots of reasons why we need all the systems to be singing together. And unfortunately, such is the stress and the demands on CAMS that there are long waiting lists. So we have to find ways as a society, as an NHS, as systems, local government, to bring things together and not fragment them. So thank you very much for that.
Js, thank you very much for that overview. Grateful to you, and you touch on a lot of key messaging, and I'm sure a lot of our friends on the Zoom call will want to pick up one or two of those themes. And friends, do feel free to interact via chat, and I'll be picking up some of your comments and putting some of those questions to our guest in a few moments. So do keep your messages coming. Friends, moving forward, our next guest is Dr. Joan St. John. She's a senior GP specializing in primary care, but particularly in diabetes, and was Diabetes UK's one of the first clinical champions. So we are so grateful for her to take the time out this evening to join us. Incidentally, friends, you may not be aware, but Joan is one of the co-authors of the best-selling Carbs and Carl's World Foods. So I think the book is still available. So if you haven't bought the book, feel free to buy the book. It's an amazing read. Joan, thank you very much. And if you could please provide context from the primary care perspective, and again, focusing on what one key priority for you is, please.
Thank you very much, Councillor, and thank you very much to the Advocacy Project and everybody for inviting me and letting me be part of this really important panel about this really important topic. I will pick up on what Professor Bambra said, that 80% of adults who are experiencing mental health problems, this started during childhood. And we know that about 50% of the adults who are suffering mental health problems, those mental health problems could have started before the age of 14. And, you know, it's an often said saying that prevention is better than cure. And I would absolutely endorse that in this context. For our young people and children, it's so important to try to preserve mental health as opposed to having to try to cure or treat any mental health problems that arise. So, and again, to pick up on what Professor Bambra said, yes, we all want to work as an integrated system. And I think Professor would probably agree with me that as health practitioners, we would be happier if we didn't have to see children and young people if their mental health was preserved before the need to get to health services, formal health services. And how do we do that? Well, Councillor, you touched on it. It's family, it's extended family, it's the village, it's friends, it's third sector partners, it's the local authority. It is health in its fullest form. So that is physical health, so exercise and nutrition and all of those things that go to make us healthy that are so vitally important, not just for children, but for the adults, for the family, for our community, really. So in terms of children's mental health, it's so important to try and preserve it. We know that the pandemic has had an adverse effect in terms of the prevalence of ill mental health in children increasing, but now we need to do what we can to ensure that going forwards, we are able to treat and deal with that, but also to prevent further mental ill health occurring in children. So primary care is very much at the forefront of that, but is integrated within the whole system. And that whole system is not just under the banner of health, it's health in its fullest form.
Thank you very much, Joan, for that. Grateful to you. We've heard Professor Bambra and Dr. St. John talk about integration and working together. And our next guest is Robin Duran. And in fact, she leads from Northwest London Integrated Care System as the brand's lead. But she's also more importantly Chief Operating Officer at CNWL, one of the largest NHS trusts. Robin qualified as a nurse in New Zealand and has held a number of positions in management of various mental health, addiction and learning disabilities services in New Zealand, Australia, and indeed here in UK. But I just wanted to highlight a couple of areas where she has played a most significant and vital role in recent years. Firstly, following the Grenfell tragedy, she led the service following that awful tragedy that unfolded before our eyes. And more recently, during the pandemic, she has been leading the focus work around pockets of Brent, which have suffered most devastating impact of COVID, particularly neighborhoods in Church End and Alperton. So Robin, thank you very much for joining us this evening. Grateful to you. And I wonder if you could provide some context from the commissioning aspect. And again, if you could briefly touch upon what one of the key priorities for you is, please.
Thank you, Ketan, for the introduction. I think in terms of, I think colleagues have already talked about the importance of an integrated nature of all agencies working together. You know, children's mental health isn't separated from their physical health, separated from them as a family member. So there is something about, and my job, as you said, as the ICP director for Brent, is about how do we bring all the agencies together to look at the child in the whole. I think that the point that I would want to make, and the biggest learning for me from Grenfell, from a lot of the work that I've done over the years, the voice of the child is key. It's great to see that. I certainly can see one young person here. I hope there are more. But I think listening to the voice of the child and what their needs are, also recognizing, we did a lot of work in Grenfell with children as health ambassadors, and we trained them up, and they did a lot of peer work with their peers in the schools. And there is something about actually empowering young people, listening to their voice. And I think that is something, certainly I know Jenny, my colleague who's here, who runs our Brent Health Matters teams, her and I tomorrow night, Ketan, a meeting with some of the young people in Brent, with council, young black men, I think it is, in Brent, to listen to them, because they're worried about their mental health. So I think the message I would want to give very, very clear: integrated care is important, but the voice of the child is the most important. And we must listen to the voice of the child and actually work with children and recognize the resource that they have and the power they have and influence with their peers.
Thank you very much indeed, Robin. Grateful to you. And our next guest, well, it's a double act. So we've got Georgie Naderton, who is the head teacher at Preston Park Primary School, a large primary school in Wembley. So Georgina, on completing her MBA at the Institute of Education in London, undertook some research work in Chile, in South America, in particularly focusing on rethinking curriculum design, and was awarded advanced skills teacher status. And so it's grateful to Georgina for joining us. And she's joined by our youngest guest this evening, by Veronica. Veronica, really good to see you this evening with a beaming smiles. Thank you very much and welcome. And Georgina and Veronica, I wonder if you could provide the contacts from the school's perspective. And Veronica, it'd be good to hear from you about what your experience has been like, particularly with the pandemic and the lockdown situation that we have all endured over the past months. Georgina, we're very welcome.
Thank you, Ketan. We are absolutely delighted to be here, to be engaging in such an important conversation. We're delighted that Veronica is here with us this afternoon as well. And I'm going to let you go first, Veronica, actually, because I know you've prepared a piece that you'd like to share with everyone. And this is about how Preston Park supports children with their mental health and well-being.
Thank you, Veronica, and really good to have you this evening.
Preston Park Primary School is a really fun, pleasurable and compassionate place. However, some children coming to school may not always feel happy all the time due to factors in out of school. So here's what we do. The first positive thing about Preston Park is that all adults genuinely care about the children. Any downhearted child can have their feelings resolved by several teachers as they participate in very engrossing, enjoyable entertainments, such as role plays, activities, and more. In addition, all the teachers carry a lot of empathy in themselves and can easily reassure them. We also have a variety of school values, including respect, responsibility, and reciprocity. We live our values, and this helps us generate positive thinking and positive vibes. Preston Park is a space for positivity. Moreover, our curriculum encourages us to talk about our feelings, and we have emotion coaching to help us learn how to regulate our emotions. Every single class takes part in a lesson called PSHE, which develops our characteristics and how we follow our values. In PSHE, we solve problems, think about situations, learn about our mental health, and also emergency causes. Furthermore, we have a place called Place to Be, where you clarify the issues that is currently occurring to you and clear up any negativity. This means children do not have to carry worries around with them. Adults are available to talk at any time of need. We have phenomenal staff members who is definitely capable in making this happen. During lockdown, our school had Wellbeing Wednesdays, where we did lots of activities, including writing diaries. One of our main teachers, Miss Cllr, schedules assemblies on Mondays where we learn about our rights and how to keep safe and always happy. Preston Park is a considerate place and will always keep pupils very passionate and keen towards learning. We all look out for one another, and that really helps it when it comes to mental health.
Wow, thank you
Veronica.
very much for that. Goodness, she's far better than I am, isn't she? I think she can take over. And I can take a back seat now.
That was entirely put together by Veronica independently as well. So
my goodness,
Veronica,
you're going to be writing. Veronica, you're going to be writing all my stuff from now on.
Thank you.
And when I heard that, I just felt so proud, really. And that's everything that we do at Preston Park, really, is what the professionals are saying here this afternoon. We're putting into practice. We're being upfront about it. We're keeping the conversation open. We're recognizing that mental health can be invisible. And that's almost the hardest priority that we have at the moment. We can obviously react to what we can see, and we are seeing self-harm, depression, lots of things, lots of trauma creeping in at a younger and younger age. And that's kind of a trend that we are seeing. But like what's been said this afternoon, we really focus on building those proactive systems and structures so that we are looking, prevention is better than cure. And we want to build a happy school. That comes down to everything that we do at Preston Park, is creating that open, inclusive, safe, happy environment where all children and staff can bring their whole selves in. And so well-being is really important for our children, and it's also important for us in how we look after our staff at school as well. And we do that through conditioning our environment. There are 4 key drivers for me as the head teacher when I'm looking at conditioning our environment. And it starts with belonging and really focusing on that identity and belonging, celebrating difference, celebrating ourselves, getting to know who we are and living by our values. And then trust, building trust with all our key stakeholders, and for our children, knowing they've got trusted adults that will listen and will listen without judgment and will be there to support, and building that trust with parents and working with families and having our offer almost extend into the family home as far as we can possibly go. Knowledge creation, so inspiring children through that love of learning and really helping them connect to find their talents and what they're interested in and help them pursue that is really, really important. And autonomy, giving children the space to problem solve independently and take risks in a safe environment is so, so important. And within a framework enabling that. So we have a huge pastoral offer in that regard in terms of our curriculum, our hidden curriculum, our emotion coaching, which is fantastic and enabling children to regulate emotions. But I think really it is being upfront about it, keeping the conversation open, training staff so that they're able to recognize it, and being really clear that actually we may not see it. We need to be really knowing every single child really, really well. And it's our relationships that make the difference.
Thank you very much to both of you. Really grateful to you. Friends, I'm going to now kickstart with taking some questions. So do feel free to share your questions, your thoughts on the chat. And I'm going to be exploring some of the themes that came from our guests in a bit more detail. But I'm equally very happy to have your contribution and make it, as I said a few moments ago, and as Judith alluded at the start, really keen to make this as engaging and interactive as possible. So let me start off with the first question, and perhaps while you're thinking of your own questions, let me just put my question to Professor Bambra. Js, we've just heard quite a detail about various preventive stuff that is happening at various different levels. But I'm keen to understand a little bit more from you, please. What work is being done to promote resilience? Of course, prevention and early intervention, please.
Well, so, I mean, resilience is such a buzzword, isn't it? I mean, sometimes I find that hard to define, to be truthful, but I think, but if you look at, in particular, resilient individuals, you see, everybody has a break point. It is systems. And I think what we need to invest is in the systems. I think by the time a child needs to be referred to CAMS, really the system is a little bit broken, I have to say. We want to stop. I think somebody mentioned that before me. I think it was probably Dr. Joe. I think we need to invest in that prevention. We want to be the two key areas where children are going to spend most of their life, if not all of their life, are family and school. And I think those are the places where we want to give kids a good start. We want to make them happy places. We want to be able to enable them to have those conversations, to prevent bullying, nip things in the bud. You know, there are simple things that cause stress, but we overlook them. And when we overlook them, they become, and I see that, you know, I've seen that in fact in older people, people who are over the age of 80, they will remember that when they were 12 years old, something happened in their family or school, and it blighted their life. And so that is where we need to invest our efforts in. That is what, so resilient systems, Ketan, rather than resilient individual, because everybody, all of us, have a point at which we will break.
Thank you for that. Let me just take one question from our chat. We've got a really good question around integrating various different services. And we got a question from one of our friends who says in the chat, what can be done around integrating the child's outside life? And perhaps if I can ask Joan, and perhaps Robin might want to come in here as well. So Joan, what can we do to integrate the outside activities, instilling what's happening in schools, as we were hearing from Veronica and Georgina? What we can do outside, please?
So thank you very much, Councillor. I mean, I think I was just so inspired to hear what was going on in the school. And it's almost as if we could recreate some of that outside of the school setting. Sometimes that's possible within a family, sometimes it's not. But if we could recreate more of this, so more active listening and less talking, then I think that is one of the key things that we can do. So the school, I heard, was a very open place. It had its radar on, so it was looking out for those children that might not be thriving, but it also enabled them to come forward with any issues that they had and to have that autonomy, take that responsibility for their own health as well, with support. One of the things I wanted to say was, I think that recently young people have done a lot for us in terms of mental health. Because if we look back maybe, I don't know, 10 years or so, a lot of us didn't talk so much about mental health. Different aspects of mental health. We've heard about bullying, we've heard about social isolation, we've heard about anxiety, depression. And I think with the rise of things like social media, young people have directed us, they've led us into being more open about these topics and actually addressing them and having a conversation about them. So I think what we need to do is to almost recreate some of what's going on in Preston Park. I love the idea of the Wellbeing Wednesday, you know, so even if it's a period of time that we can devote to thinking about our well-being, I think is one fantastic big step forward, because just even having awareness of it means that you might actually be able to recognize that things aren't going so well and do something about it.
Thank you very much for that, Joan. Robin, I wonder what we can do. I think the integrated care system provides us, places us in a good place to be able to bring various different dots together. And I wonder from the commissioning perspective, how are we working our way around different services which perhaps are doing some fantastic work, but perhaps in isolation, perhaps in silos? How are we bringing all of those different threads together, please?
I think, interestingly, Ketan, in the Children's Trust Board today, we were having a discussion about that. And I think it's wider than just the agencies that are the statutory organisations around the table. I think lots of children belong to faith groups, they belong to activity groups, they might play sport. It's about how do we empower and actually the staff and the volunteers in those groups, a bit like Georgina's team, who are clearly inspirational in terms of working with the young people, so that we're all giving the same message to young people. So if I'm going to a boxing club or a multimedia event, or I'm running a faith event, then actually the staff that are in those events, be they volunteers or paid, are actually trained in terms of some of the techniques, I guess, and some of the values-based ways of working with children, so that children are able to be open about how they're feeling, have a safe space. I think you're right. Interestingly, the young people we're meeting tomorrow night have led us. They've said they're worried about their mental health. They want to talk about it, and they don't think that we're serving them well. So again, there is something about that older young people. I think they're kind of late adolescent, but I think it's about using all of the age, particularly the third sector, the places that children go, and actually, I guess for us as statutory services, how are we taking our knowledge and our skills and our resource and some of the dynamism that Georgina and her team have out to the community to make sure that we're all giving similar messages. I think people keep talking about it takes a village to raise a child. Well, somebody's lived in Brent for 30 years. It is a bit like a village. There are lots of little villages within Brent, isn't it? There's lots of neighbourhoods. So how are we using our communities,
Sorry, I think
a lot of work.
Thank you, Robin. I think we lost you for a moment. Perhaps if you just want to repeat that last few words, please.
So I think I said it, a lot of people talk about it take a village to raise a child, and I think we've got lots of villages in Brent. We've got lots of neighbourhoods, and it's how we're working at that neighbourhood level around the community centres, the family centres, etc., to empower them to give similar messages to the one Georgina and her team are giving to all the children who they are working with and supporting in various ways.
Thank you very much for that. So we've got a question from Julia, and she's asking about how can we be more open about mental health? And I wonder, Georgina, I know you talked about Wednesday and the good work that is happening. How can we maybe even more open, and what sort of messaging are you sharing with your pupils that they can be open and feel that they can openly talk about their stress or whatever anxiety they're experiencing, not just within the school setting, but outside with their peers, with their parents, with their friends, and so on?
Thanks. So yeah, it all comes back to really the conditioning of the culture. So where we have kept the conversation open, we do see children coming forward with problems and issues. They want to talk about them. They know that they can get it resolved, or they can get support. And so that's been really, really positive. And we've actually had a lot more caseload because children are coming forward, which is great. So you know that's working. So really, it's about giving the children the skills to be able to recognize when something makes them feel slightly uncomfortable and what they can do to address that. So emotion coaching is a great one that we use, and that's where we validate children's emotions. Let them know that it's okay to feel how they're feeling, no matter what it is. And that comes first before limit setting on behavior. Everything comes back to acknowledging how we're feeling and that that's okay, and then looking at why we might be feeling like that and what we can do to address it. So giving the children the tools to regulate themselves has been really, really powerful. I think we address it through our curriculum in many ways, almost like our hidden curriculum. that it's thread through everything. And I like what Veronica said earlier about it coming back to our values and really holding that at our heart in terms of being able to be open about how we're feeling. And like I said, having that environment where you can bring your whole self in, where it's okay to be you, be true to you, and there'll be no judgment, and we're all together as a team. And that's a really important one, especially when we're working with parents, because with lots of mental health, there can be many issues or many factors that are actually contributing to how the child is feeling and what's going on for the child. And so working with the parents is really, 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 really important. And so prioritizing that and making that just as important is what we do at Preston Park. And one thing I would like to say, just going back to the last question, I feel that role models for children are so, so important. And I was really sad to see some services cut, like youth clubs, because I think they can be so powerful in helping shape young children and developing the whole child outside of school with the outside aspect. So I think services like that, where they can come back, activity clubs, everything that's engaging and outside of the school setting, really, really important.
Thank you very much for that. Just looking at the messages that are coming fast. Thank you very much for those messages. Let me pick up another message from the chat. We've been talking about children and the learning from the school. But as children transition into young adults, I wonder, Js, what are we doing to ensure that they are safely transitioning, please?
So when we talk about this is well, I'll admit here in this closed group, I'm sure that I'm afraid that transition doesn't work very well. So when children have a mental health problem, when they're teenagers, when they go into adolescence, particularly the jump from adolescence to adults, and I pioneered this in Manchester when I wrote a paper about transitioning from adolescence to adulthood. It's not a great system, I'm afraid. We have to have a proper system where there's an overlap between CAMS or adolescent services and adult services, because they might have been in body, they look like adults, but they're still in that children phase. And I wish there was a better way to do it. I think there is a better way to do it. My paper did demonstrate that, but I'm afraid services don't always adhere to what is required from them. My best hope is that people who listen, because they're also coming out of school, you remember. A lot of their systems are changing. This is the time of the biggest emotional turmoil in anybody's life. When you're leaving school and you're going to join university, you've got a mental health problem, you might have to look for work, but you're with a CAM service and you're going to go into a service with adults, many of whom will be in their 40s and 50s. So it is a difficult area. I wish I had an answer for you, and the answer is there, but the system isn't robust enough to provide that support. Ideally, that's where it should be. The support from the National Health Service, support from the school, support from parents to make the transition a lot easier.
Thank you very much for that. I've got Robin and Jenny. Robin, please.
Just to say, I guess in Northborough, if I put my Chief Operating Officer hat on for CNWL, we have in the last year developed a 16 to 25-year-old service. So JS, I suspect that's what your paper was about. So we've recognised, we've got some of the new CAMS money that's come in to recognise exactly that we need that kind of overlap group, because before the cutoff point was 18, it was almost like kids fell over a cliff and then somehow they ended up in adults. So we've developed a whole new service across the whole of Northwest London for 16 to 25-year-olds. And we're looking at how we can integrate that into the wider system. And we have a decent amount of resources. We have a lead consultant who's leading with that in a multidisciplinary team. So absolutely agree with you.
Thank you very much for that. Jenny, really good to see you on the Zoom call. Thank you very much. Jenny, please.
Thank you, Ketan. Yeah, this is a question for Georgina. And Georgina, I just wanted to really applaud and commend you and Veronica on just this fantastic work that you're doing. And Veronica, you are so confident. I'm just awed by you. Honestly, it's fantastic. Veronica, I just wanted to check with you if there was any sort of challenges that you were facing when you were implementing this from either parents or children from BAME backgrounds. You know, we know that sometimes parents do not seek help because they're a bit worried that, you know, if they do, then their children might be taken away or something like that. So I just wondered if you experienced this.
Thank you very much. Georgina and Veronica, please.
Yes, so that is something we've definitely experienced, and I think that comes back to the trust. So where we are dealing with specific cases of mental health that are quite high level, and there's lots of multi-agencies involved, particularly social services, there is almost a pushback of, I don't want to engage with the service because they're going to take my child away, or because they don't have the intention of bringing us together. You know, the intention is not clear, and so that's really such a challenge. And we've had it where we've, you know, followed our duty of care, referred to social services, tried to work with the family, but because that referral has gone, they've then decided to move to a different school because they think, okay, well, that's going to take the problem away, when actually it doesn't. So building that trust and really trying getting that message through is something that we're really working on at Preston Park. So we've actually made a safeguarding promo video, which will be coming up on our website soon, just to really help explain the process and how social services are there to always support in the first instance. And we always want the best interest of the child, and really trying to put the child back at the centre of this, and say, look, we're all working together and we're all working for your child. So let's get together and look at what we can do.
Thank you very much. Veronica, I don't know whether you wanted to add anything. That's fine. Thank you very much. Feel free to jump in whenever you want to, Veronica. Just catch my attention, all right? Thank you very much. So I want to now move to the next level, please, if I may, just direct the conversation towards when things aren't going quite right with early stages. And Joan, I wonder what work is being done to improve the access to effective support when things aren't quite right or going quite in the right direction, please.
Thanks very much, Ketan. And so I think I would follow on from what Georgina said about trust. And in primary healthcare services, that is a very vital part of the work that we do. So we work with the whole family, sometimes the extended family as well. And one would hope that the trust has usually been built up over a period of time, so that if unfortunately a family starts to experience a period of crisis or things not going so well, that there is some trust within that primary care service that they would seek help from the service. Having said that, I have to agree with Georgina that I have also experienced sometimes when you have to put the needs of the child first, and that may cause some friction, let's say, with the rest of the family, because they have fears that their child may be taken away. But we would always put the needs of the child first. We have a duty of care to do that. So in terms of primary care, I said it's more about this than it is about that. And I think it's about showing children and young people that we are there for them if they find themselves in a position whereby maybe friends or family or the school are not a place that they can go to for whatever reason, and that maybe things have escalated, that primary health care services are there as the first point of call after those other services, to enable them, to signpost them, to direct them, to refer them, if necessary, to the next step services. So we would work not only with that young person, but we would respect that young person's confidentiality, but we would try our best to work with the family and, if necessary, the extended family.
Thank you very much for that. And Robin, what about the most vulnerable, please?
I think one of the things that troubles me most, Ketan, is when I hear about young people who end up in A&E departments self-harming because there's no other option for them, and unfortunately that happens a lot, more than it should do. So I think there is something that we're working on about the wider system. I think, you know, from where Joan said that somebody might turn up to a GP, she might be able to do something, but then something happens in the family or there is pressure in the system and they don't feel supported. So there is something about, I think the point that Georgina made, there is something about the wider system in terms of what other activities, what other things are there for children in the community before they get to that point where they feel hopeless and they don't feel that there's any option but to self-harm and they end up in an A&E department. I think we've failed children if that happens. And so there is something about what the discussion we are having in the wider system in Brent as part of the Children's Trust and the work, we have a focus group on mental health and CAMS, is what extra resources do we need from some of the new money that's coming into CAMS further down the line in terms of the third sector, the voluntary sector, what money are we putting in to the system to prevent it getting to that stage? So it is about that, because actually, and how accessible are we as CAMS services? So what conversations are we having with families so that they feel they can reach out to us and actually get help? And I think a number of people have said we need to work with the whole family, as well as obviously the child is primary in this, but actually frequently the whole family need to be worked with.
Thank you very much. And friends, so we've still got about 10 minutes left. So if there are any questions for any of our guests, feel free to put them in chat or just raise your hand and I'll be very happy to bring you in. I've got Georgina and Joan. So let me bring Joan to begin with, and then I'll come to Georgina. Joan, please.
It was just a very quick point, because I said earlier that young people and children have sort of led the way in terms of getting us to be more open about mental health issues. And I think they've also led the way in terms of their use of social media and other forms of perhaps finding support and help. Let's say primary healthcare services don't fulfill the particular need of an individual, or the school or the family or the extended family. They haven't got somebody, but they've managed to find somebody in the wider social media community. So I just wanted to highlight that I found some fantastic resources, you know, web chats open 24 hours a day, 7 days a week. So there are other means of people finding support, assistance, and a listening ear, you know, somebody to chat to if they feel desperate.
Thank you for that, Joan. Georgina, and then I'll bring Varsha in. Georgina, please.
Thanks. I just wanted to add, really, and that's really building on what's just been said. It's also how we educate parents and families in terms of not only just the signs to look for, but in terms of the structures and systems that they have at home. So the internet is a massive one. And in many cases where there are issues, there may be children who have access to a phone or a tablet or the internet, and it could be unlimited and not the parent not checking what the child's doing online, and that really opens up a lot of risk to that child. And so really helping our parents work that tension between what's safe for the child to be independent about and what actually we need to be having a really close eye on and that we are monitoring. So I think that's a tension that exists, and one of our challenges that we do find at Preston Park.
Thank you very much for that, Georgina. Varsha, please, good to see you, Varsha.
Thank you, Georgina, for bringing the risk of things available across the internet. We've got a digital divide, I would say, that parents are less confident in using their digital space than the young people. And sometimes with assessments and forms to be filled out online or whatever. It's a very uneasy space for the parent who means to do well and they don't know the boundaries. So in some way, we need to do this education process and use some of our outreach into communities, that, you know, communities take this on board and actually speak from a trusted place, so that we help both generations in their ability to navigate the digital space.
That's an excellent point, Varsha. Thank you very much for that. So let me just ask Robin, as a commissioner, I wonder if you could just tell us a little bit about what the commissioners are doing to bridge that gap, please. And perhaps I can then turn to Georgina to see what schools are doing as well on that front. Robin, first, please.
Yeah, I'd say, Ketan, I'm probably not a commissioner. I'm probably a system integrator. So I don't actually commission things, but I think we bring people together to say, in Brent, the whole point of the ICP is how do we use all of the resources we've got? And we have a lot of resources in the statutory services that we are operating to be in the best interest of the child. And I think somebody in the chat has asked about, you know, how are we bringing mental health professionals into schools? Well, we are doing that, actually. We do have CAMS workers in some of the schools. So there is something about using that. We do, in terms of some of the digital poverty or digital awareness, we also have programs you do, Ketan, in the council. You have a huge resource available in the council for that. And within the trust that I operate, we also have a resource, both to help those that are digitally excluded, but also to help develop new skills in that area, which I think is really important, particularly, I think, as Varsha said, for the families, because I suspect that Veronica and many of her friends in the school are far more capable in terms of digital platforms, and most of us of a different generation, and because I've grown up with it from the beginning.
Thank you very much for that. Quick point from you, Georgina.
Yeah, so we do a number of things at Preston Park. So our online safety curriculum, first of all, is really strong for the children. So they're getting it. Every year group has online safety. It's a massive trend. We have lots of outside workshops that come in and deal with real issues with the children and what would you do in certain scenarios, a lot of problem solving and thinking, which is great. So extending that to the families, we do workshops online for families. We invite them in where there are more specific issues. We deal with them together with the families. We have leaflets and posters and things that like just really try to get the information out there. So for example, something like TikTok, there may be something particularly that's trending with TikTok at the moment that's not great, so we'll make sure we get a leaflet out there, something really visual to parents. Please look out for this. We had that with Fortnite. You just get these different trends that children are into, so we find out about those and educate parents on what to look for. We ask our parents to have devices under monitoring and to have the parental locks on there and all of the safety software. And we actually say to our parents, if you're not sure how to do it, bring your laptops and devices in, we'll do it for you. So we have a clinic where that takes place. And for the children themselves, they're not allowed to have their mobile phones with them in school. They bring them to school because we know it's for their safety. They need to be able to communicate if they're walking home alone or being dropped off alone, but they have to hand it in. And it's in a secure, locked away area for the whole day, and then they get it back at the end of the day. And then you see us on the gate at the end of the day saying to children, don't look at your phone, look at the road, please, because there is a temptation to be trapped into the device straight away. But yeah, ongoing challenge that we work through.
Thank you. We're coming to our finish time, but before we finish, let me just turn to Veronica. Veronica, you've been listening patiently to all the contribution, all the comments from friends. If you have just one ask that you would want, what would that be, please? How can Georgina provide something more than what is being provided at the moment, or what is missing at the moment that you would want or you're looking to have? Is there one thing, or have you got everything that you could possibly want?
In our school, we respect the values, which is really good, and we also follow them properly. But maybe we could have like more jobs for children so they can use more respect and like help others if they're having really bad situations. So they could be more jobs and more like different stations with different jobs and people stay there. And if kids are like upset or downhearted, they can go to those children, which will help them out.
Perfect. What a wonderful reply to finish this session on.